All right. Welcome everyone to the education session of the NorCal Symposium for Climate, Health and Equity. I am Katie Conlon, an assistant professor of environmental epidemiology at UC Davis. I was a faculty advisor for this session, which was predominantly put together by our wonderful medical students from UC Davis, Amy Tsai and Dr. Avni Bhatt, and Neha Pondicherry, who's a medical student at UCSF. We were joined by Jorge de Luna, who is the director of Stanford's Community Engaged Learning and Health. So we really are excited to present the content to you today, following our previous sessions, especially with Dr. Robert Bullard talking about the immediate effects of climate change and inequity. It's clear that we know that climate change is no longer deniable, and the impacts pervade every aspect of our lives. And this results in health effects that medical professionals and community members can struggle to understand how to mitigate. So this session has two goals. First, to model how to incorporate climate change into medical curricula, and then to illustrate ways that we can educate our patients on the impacts of climate change. So whether you're a student, a community physician, or health advocate, or a researcher, we want you to leave this session equipped with skills and ideas and maybe motivation to incorporate climate change education into your sphere of expertise. So a little bit of housekeeping details. As I mentioned, this is a very packed panel, and we're excited for everybody to be here. So each panelist is going to give their presentation, and then they're going to have about 5 minutes of Q&A following that. And we have this wonderful Q&A feature here with Zoom, so please use that. We're going to use that to keep track of questions, and then we can knock them off as we go through them. After each panelist presents their information, we're going to have a guided discussion, which we're really excited about. We don't want it to just be something that we do. Please engage as you have questions. Use that Q&A feature. You can also raise your hand, and if somebody else has the question that you had that you're burning to ask, you can upvote, which is really fun and a great way to show support for various questions. So with that, I will kick it over to Megan. So Megan, if you want, you can upload your slides. So Megan Duckworth is a third-year medical student at the Alpert Medical School at Brown University. She has led the Planetary Health Report Card at her medical school in 2019, and is in her second year as the communications lead. She's also helped launch the Planetary Health Task Force at her school. And we are delighted to hear her comments about the Planetary Health report card and how to integrate it into medical curricula. Thanks, Megan.
Thank you so much for having me. It's really a privilege to be a part of this panel with more esteemed people than I. But today I want to give you a sort of case study of how to incorporate planetary health into your curriculum using Brown as a model and describing the Planetary Health Report Card as a catalyst for this. So I'll jump right in. The current state of affairs, we're all very familiar with this. There was a recent publication jointly from over 200 journals that called climate change the greatest public health crisis of this century and called for urgent action. We all know about the summer full of devastating daily reminders of the changing climate, from floods in the US to floods in Europe to wildfires. We're intimately feeling those impacts and the health ramifications of this changing climate. Despite that, less than 15% of medical schools globally incorporate planetary health into their curricula. And this can feel a little bit distressing as a medical student who has a million other things on their plate. And within that context, in walked the Planetary Health Report Card for me. So I learned about this through being one of the leaders of my eco group at Brown. This is a grassroots initiative that was started at UCSF A cohort of students there started it. It's a metric-based evaluation inspired by the White Coats for Black Lives Racial Justice Report Card. It provides a framework for evaluating medical schools' commitments to planetary health, and we do that across 5 grading domains. I'll focus in a little bit on the curriculum aspect today, but it also covers interdisciplinary research, community advocacy, support for student initiatives, and sustainability. The goal here really is to help create some institutional memory that provides a framework for spurring change at the institutional level around climate change, incorporating planetary health and its health ramifications into our curriculum, and better preparing physicians for providing patient care and facing the health effects there. So we've had 2 publications of the report card. This will be an annual project. The first one we published in just as the pandemic was taking off in 2020. 13 medical schools completed it in the inaugural year, and it really helps spur some change at Brown and make planetary health a topic of conversation with administration. Amazingly, we have found so much momentum. Within the next year, we grew to 62 medical schools across 4 countries. And within this year, we're aiming to include Germany and potentially Japan. So it's really a global effort to face the global threat. I have to give a shout out to one of our co-directors, Hannah Chase, who almost single-handedly recruited, I think it was 30 out of 33 medical schools in England. So it goes to show that one motivated person can really make a lot of change. And I'm hoping that that statistic, about 15% of medical schools incorporating planetary health into their curricula, will change soon. So we'll need to be studying that. Here are 2 screenshots of our summary reports from Brown, the first on the left and the second from Earth Day of 2021 on the right. As you can see, Brown did not make significant gains in 1 year. And I think that speaks to the difficulty in kind of navigating the bureaucratic hurdles that I have certainly faced in my medical school, and I know that other students have at theirs. It gives us an idea of where our weaknesses lie and where our strengths lie, and gives us just this roadmap for how to best target the ways that we can improve. And I think it provides a really wonderful assessment and tool to bring to your administration to show them, here are ways that we can improve, and be extremely tangible about where we're failing. You can see Brown is not doing so hot in the community outreach and advocacy arm. And that is really distressing when you put the climate health crisis into the context of inequity. So knowing all of these results, we presented them to the deans, and I would say at Brown, we had a really favorable response, and it's been different at every medical school, of course, but wonderfully, we've been able to get their ear and got approval to establish a task force, which had 2 arms to attack that community advocacy and engagement issue that we had, and then 1 arm to work on the curriculum aspect. And I'll kind of cover that one today. So the way we went about this was recruiting medical students and faculty who were engaged in curriculum efforts. This was an interdisciplinary team. We reviewed the current curriculum and created a proposal for incorporating planetary health and environmental justice into the preclinical curriculum. I would absolutely encourage any student who's interested in doing something like this to utilize existing resources for guidance. There's no need to recreate the wheel, and there are wonderful guides out there for you. We relied heavily on the Med Students for a Sustainable Future curriculum guide, and then used data from the U.S. National Climate and Health Assessment to help us guide where we could fit in planetary health and its health ramifications into our curriculum. Wonderfully, this preclinical proposal was approved by the Medical Curriculum Committee in May. And if you're being kind of scrutinizing right now, you'll recognize that this really focuses on the preclinical years. And that is one of the issues that we're running up against. So proposed changes were incorporation of planetary health and environmental justice topics in preclinical years. So this is weaving in the reality that there are disproportionate effects on communities of color. There are disproportionate health effects on women of reproductive age, pulling in the pulmonary effects of air pollution into the pulmonary block, these kinds of changes. We've also gotten approval for training students on taking an environmental and exposure history. We have created an elective about the relationship between a changing climate and infectious diseases. And then we've instituted a mandatory training on proper healthcare waste disposal practices, which was really important after there was a waste audit done by some of the students at my school, and we realized just how poorly people are disposing of all of the waste that's created in the OR. This is all caveated. These aspects of progress are caveated by the fact that we have so much work to do with the clerkship years. We had a really well-received presentation with our clerkship directors about ways to incorporate our thoughts on the health effects of climate change into some sort of longitudinal curriculum. And I'm hoping to learn more actually from some of our other panelists today about how to make that happen in a way that is cohesive, because in the third and fourth year, everyone is having such a different experience across their sites and the electives that they take. So we're hoping to work on that. That's a big goal moving forward. I'd be remiss if I didn't discuss the highlights and lessons that we've learned from Beyond Brown. Oh, sorry. I want to shout out Georgetown's Environmental Health and Climate Change Workshop, which pulls on climate change communication specialists to educate the students on how best to communicate with patients about the changing climate and its health effects. And they have an opportunity for role play and simulating a patient encounter. At the University of Hawaii, there's an emphasis on centering the indigenous knowledge around ways of protecting the environment and the impacts of environmental racism, but centering it in a way that is not about victimization, but about indigenous knowledge and what we can learn and do better. At UCSF, I have to give a Northern California shout out. The Earth Center recently launched the Environmental Scholars Program. This is amazing because it's a funded research opportunity, which if you read the report cards, there are not so many of those available to students in medical school or nursing school. And this is an incredible fellowship opportunity for those interested in environmental health and in community engagement. And lastly, I'm going to totally butcher this medical school's name, but Leicester in the UK, their medical school launched their first student-led sustainable medicine society, which is an incredible first step to get like-minded individuals together to drive these kinds of changes. And so I would like to finish this presentation just saying how proud I am to be a part of this kind of movement that has gathered so much momentum. I would encourage anybody who's interested who is not involved in the Planetary Health Report Card to please reach out. We're still recruiting for this year, and we have tons of support. We have regional leads. We have many people who have participated in the initiative before who would love to guide you through this. I also want to put a plug out there for the PHRC happy hour happening at the end of the afternoon. Sonia is a wonderful resource and can talk you through any questions you might have. And we are holding a symposium on October 16th, where many medical schools will be presenting their experiences. So you can learn more about not just Brown's experience, but others in making change with the curriculum and beyond. So thank you so much for having me. It's really a privilege. These are my references for you.
Excellent. Thank you so much, Megan. That was really wonderful. So I'm new to the Planetary Health Report Card. I think it's such a fantastic tool. As somebody who likes to do, implementation evaluation, I'm really curious about some of the results that you had. And so you'd mentioned some challenges with, bureaucratic problems or challenges there. And one of the scores that you had a little bit lower, it was a B minus, was student-led initiatives. And since this morning we heard from Dr. Bullard, and he was talking about how important youth engaged activities are. And I was wondering, what are the types of initiatives that you wish you had a little bit more support from administration on?
That's a great question. So I think that we scored, I should go back to that slide and talk through this, but we are lacking some things that other schools have. So like when I talked about that funding opportunity for research, those things are sometimes lacking at Brown. It's been difficult to shift funds, is what I would say, towards environmentally minded activities, I should say. So when I read other schools, support for student-led initiatives, I was like, oh my God, that is incredible. For us, when we're putting on like our Earth Day or Earth Week events, it's kind of a scramble to find money and we're applying for grants. And so I think that a really big aspect of it is a lack of funding, which isn't to say it's unavailable. It's just been a challenge to garner what we think Planetary Health deserves. I also think that there needs to be more support for interdisciplinary, like student aspects. Our medical school is somewhat siloed from the rest of the grad student community, and that has been an interesting and kind of strange dichotomy because we're sort of doing things in tandem but not aware of it. And so some more support for those kinds of student-led like group initiatives.
That is excellent. Yeah, that's excellent insight. For those of us thinking about how to do something similar, maybe getting a bit more financial support is the way we start. Okay, well, we have some questions still for you, Megan, but I want to hold that back until our panel discussion. So if you aren't getting your question answered, don't worry, we'll get to it, I promise. So as we have our next panelists put up their slides, I'd just like to take a moment to introduce them. So Dr. Iverson is a hospitalist at Zuckerberg San Francisco General in the UCSF Department of Medicine. And he's going to be presenting along with Dr. Whalen, who's a professor of clinical medicine at the San Francisco VA Medical Center, and she's also UCSF faculty. And together they are working on curriculum development at UCSF, bringing in their particular areas of interest that we are about to hear about. So with that, I'll hand it over to y'all. Thank you so much.
Thank you so much. Hi, I'm Nick. I use he, him pronouns. I am one of the co-directors for the UCSF. We call it the Climate Health and Sustainability Education, or CHASE curriculum. It's kind of a comprehensive approach to looking at climate health and sustainability in the School of Medicine. Like we just heard, I'm a hospitalist. I also work on the social medicine consult service at San Francisco General, and assistant professor in the School of Medicine. I'll let Heather introduce herself.
Hi, I'm Heather Whalen. Thanks for having us today. My pronouns are she, her, and I'm also a hospitalist, but at the VA. I'm involved in a variety of different medical education roles, including career advising for students at UCSF, and I'm excited to be here today.
Yeah. Great. So just a quick roadmap of we're going to talk about the background for this curriculum, of which the last presentation was a great introduction for us. A lot of overlap between our backgrounds, the curriculum development process that we went through, talking about our team, the methods we use, what foundational principles we considered in developing this curriculum, how we got stakeholder buy-in, and then what we think about the path forward and what that could look like and the lessons we've learned along the way.
So I'm just going to briefly talk about how we approached this. We thought it was clear that climate change is having health impacts now and will have growing health impacts for all populations. And we started by doing a literature review, looking at what types of curricula existed out there, both for UME and GME, and there really was very little. I'd say like in the last couple of years that has grown. We started this in 2019, so it's been a little while. But really curricula that were comprehensive, focusing on climate health content, skills, and attitudes that we thought physicians would need. And we were fortunate to have an opportunity to apply for a UCSF Medical Education Innovations Grant, which provides a very small amount of funding, but also a little bit of a footprint and attention. We needed to get the buy-in of the Associate Dean of Curriculum, John Davis, in order to get this grant. So that was the first step with stakeholders. And then we were just fortunate, I think, at UCSF to have faculty and staff who had already been doing work in this area. So Ariane Teherani is a PhD at UCSF who has deep knowledge of this content as well as curricular development, and has been a great resource. There were several student electives and a very active student interest group already when we started. And then the Office of Sustainability has been at UCSF for a few years, headed up by Gail Lee, doing sustainability projects at UCSF Health. So next slide. And so just to tell you a little bit about the team, initially it was just Nick and myself, but we were lucky to have students jumping in right away, very interested, very engaged, and really adding a lot. Alan Nadovu is an MS3 now, who started at the beginning of the project and actually did what's called a curriculum ambassadorship over the summer between his MS1 and MS2 year, learning curriculum development, and he actually was able to develop some content that was integrated in some of the existing curriculum as a model. And then Terrence Sirius is an MS2 who joined us a little more than a year ago, working on our curriculum map and objectives. Carly Hampshire was instrumental at UCSF with the Planetary Health report card that Megan mentioned in her previous talk. And that actually served as a needs assessment for our curriculum development, so helped us quite a bit in starting this. And then Neha Planetary, who's here today and helped organize this session, joined us recently to work on the curriculum, and is also going to be working with the AAMC and advocating for climate health in the curricula. Next slide. So we started with the conceptual framework based in educational theory. Won't get into that today because of time, but helpful to have that frame when you're starting. We use Kern's 6-step curriculum development model, which I'll touch on later, and is a very well-known model in medical education. We started developing a comprehensive map for a core curriculum, what we thought the core ideas, skills, attitudes would be, and then worked on getting stakeholder buy-in. And then we've been working with the school and course leadership to try to infuse this content. So this was a big part of our strategy, is not to create a standalone course or a parallel course, but to infuse it into the existing curriculum, just to have a smaller footprint when people are worried about time in the curriculum. And I think to demonstrate that this climate touches every aspect of health. Next slide. So just to review the current 6-step model, if you're not familiar, you start with what's called a general needs assessment. So just looking at the general educational gap in whatever topic you're thinking about. You do a targeted needs assessment, looking at the specific group of learners in the setting that you're in to figure out what is lacking. And then you can start developing goals and objectives that should be very concrete, very measurable, that your learners will have achieved hopefully by the time they finish the curriculum. And then thinking about what are your educational strategies? Is it going to be a lecture, a small group, a simulation? Implementation is actually rolling out your curriculum, and then evaluation is really the process by which you're assessing, did your learners actually learn what you intended them to? Those are the 6 steps, so we'll move forward.
In terms of the methods for our curriculum development, so our local data for targeted needs assessment really was the Planetary Health report card. We did do a broader literature review on climate health education, what was available in terms of resources out there. And we did find some resources, but the approach we were taking, we felt was different than what was available, and that we really were trying to make this from the beginning a comprehensive curriculum, taking a step back and thinking really broadly about how do we map out what an entire comprehensive curriculum would be that should be core to a medical school, and starting from that aspect. And there were a few publications that mapped out some of those, but even those resources weren't practical enough that we could then take those resources and go to course directors and say, this is exactly what you need to implement. So we wanted to take that step back, really look at it from a bigger picture. And when we developed our goals and objectives, wanted to come up with really comprehensive objectives that should be core to a medical school curriculum, and use methods that were similar to kind of qualitative research to reconcile what should be core, what is considered comprehensive, in thinking about the broader curriculum, rather than trying to implement individual pieces of curriculum kind of at different points throughout. Create this map that ultimately would allow us to implement in a more systematic way. I think that also allowed us to get some buy-in from School of Medicine leadership, because we took this really comprehensive approach, which is really what all courses do in the medical schools. When you think about if somebody is using the current 6-step development model to develop a cardiovascular curriculum, they're not just thinking about how do I teach MI and then just incorporate that, and how do I teach this? They map out the whole course, and that's kind of the approach we took, which I think ended up helping us quite a lot in the long run. So we mapped out these goals and objectives. We mapped them out specifically to frequently updated and reputable resources. So those are things like the Lancet Countdown, for instance, which is organized in a way that kind of made sense for at least a component of our objectives. And the reason for that being, as our knowledge of these areas update over time, then we can update this resource kind of continually within the UCSF medical school curriculum as our knowledge of these areas advances. And so then beyond the goals and objectives, we actually developed this really comprehensive curriculum map, which unfortunately we don't have time to share today, but happy to share more broadly later, where we mapped out all of the, not only overall curriculum goals and objectives and the objectives that would create kind of a comprehensive core curriculum, but also the session content that should go into trying to meet those individual session objectives. We use primary literary sources, so each one of these objectives was matched with data that could be referenced for the curriculum. We then reconciled curriculum components using similar methods I talked about before, and then got feedback from expert stakeholders and hoping to share this curriculum map more widely.
Just want to let you know you have about a minute left.
Okay. I'm going to skip through this slide then. And I think this is similar to the prior talk, where it was really important for us to get buy-in from medical students and educational leadership at the UCSF School of Medicine, the Associate Dean for Curriculum, who's been pretty essential, as well as meeting with all course directors and some of the higher educational teams.
Yeah, so I'll just briefly, I'd say like major lessons learned are just to be clear on what your goals are and what the scope you can take on is, and then just advocate a lot, talk to people in the curriculum and try to get buy-in, and just start developing things. You can scale it to what you can do, but having that background thought about having a longitudinal curriculum. Next slide. And then, you know, we were really fortunate. I just want to really plug like student involvement or trainee involvement in developing this content. They've been so helpful, and we would not have gotten as far as we have without their assistance. And just that, you know, the landscape is changing very rapidly, and luckily there's a lot of momentum growing. So thank you. Sorry that there was a little too much content for our 10 minutes.
No, it's great. This is incredible content. And I'm sure a lot of attendees and maybe just myself are really want to know more about that map that you did. But for now, I'll just ask a clarifying question. And it's one that I've heard and have asked myself a few times. Is climate health the same as planetary health? And as a One Health representative, I don't know if you want to comment on what One Health is, but in terms of the medical curricula, what do you think is the best thing to put in? Like, what do you think is the best to talk about and put in formally?
Yeah, I mean, I think that my thoughts on this is that this is a question that we're continuing to consider. I think trainees need to know, like, what are the health impacts of climate, and are they, you know, what are they going to be seeing and dealing with? I think there are system issues that they're going to need to address, both in terms of healthcare system adaptation, and then the issue of sustainability, I think, is important just in terms of that's our lever to actually make a change. I think it's challenging because that's a lot to include in a core curriculum. We're currently focusing in the preclinical years, which is really mostly about what are the health impacts, but also including these threads. I guess the other thing is climate justice and just, you know, healthcare disparities overlaps in so many ways with this work, and making sure that that's an important thread that students are learning about as well in terms of advocacy.
Excellent. Thank you so much. I will hand it over to Avni.
Okay, hello everyone. So since I'm also the spotlighter, I want to make sure I spotlight while speaking. So let me make sure I do that. We'll give Dr. Henley a second to load his slides. So today we have the huge honor of having Dr. Henley here to give us a talk. He's a family and public health physician with an esteemed medical career, including over 9 years as a commissioned officer in the Indian health system, service system, several years as a rural and academic medical physician, and he's a CMO of 2 federally qualified health centers. So at Lifelong Medical, he implemented a successful nurse practitioner residency and led the accreditation process for the family medical residency program. And he's continued his mission to increase awareness of the health effects of climate change with the goal of getting community health centers engaged in addressing this issue. So without further ado, I will hand it over to Dr. Henley.
Great, thank you. That was good. You said all the things I might have said. So we'll keep going. Thank you, everyone. Thanks for coming. So this is, I suppose, a little bit of a shift from the med ed world a little bit, but because I'm involved in a residency developed, I am really interested in med, and I'm particularly interested in it from the GME perspective. So it's great to hear the schools working on it, and I think that's going to be in the next question. But I was asked to talk a little bit about what are the roles of health centers in addressing climate change, and I think so I'll say I want to talk about I want to make sure everyone understands what a federally qualified health center is. Talk a little bit about how health equity, environmental justice is a big issue for us because of the populations we care for. And then talk about some of the issues that I think health centers are just beginning to face probably and need some help to do that. And it's an important role that we need to play. So I apologize for those of you who may know this, but just in case, so we're on the same ground, a federally qualified health center has a specific set of characteristics and definitions. In order to be one, you need to be located in a high need area. You need to provide comprehensive services, including enabling services. And enabling services are things like case management, transportation, interpretation, things like that. You need to take care of all people, regardless of income, race, ethnicity, gender, anything you can think of. I think actually the most unique thing about a FQHC is that we're governed by a community board, half of whom have to be patients in the practice. And we have to do a lot of reporting of data to the feds every year. And I should say that I was the CMO of Lifelong Medical, which is a large FQHC in the East Bay. For about 5.5 years. I retired a couple of years ago from that role after starting this family medicine residency teaching health center, where the FQHC actually holds the accreditation for the residency. And I stayed on a part-time basis, kind of overseeing the program as the institutional official. So I've been involved with FQHCs for quite a while in a lot of different ways. For those who don't know, we get our recognition and some grant money through the feds through what's called HRSA, which is down over on the right, HRSA. It's one of the main federal agencies similar to like CDC or FDA and NIH, which people hear about all the time. So we're in the HRSA bucket. You can qualify as a 330 program as a community health center, a migrant health center, a public housing health center, or healthcare for the homeless programs, of which there are a number all across the country. And just to give everybody a sense of why health centers really have a key role here is there are over 1,400 now across the US, many of which are actually in rural places which lack other sources of care. Many of these health centers have multiple sites like Lifelong. And so there's well over 14,000 sites for delivering care, which includes primary care or school-based health centers, dental clinics, dental vans, supportive housing, medical respite, so quite an array of stuff. And we serve well over 30 million people now, the majority of which is providing primary care. So we have a significant footprint across the country. And to put that into perspective this way, 1 in 11 people in the US get served by a health center, and a lot of them are kids, and then a lot of people who are low income, uninsured, racial and ethnic minorities. Bottom, 1 in 3 people in poverty. So we're taking care of a lot of the people who, as you know, are disproportionately affected by climate change. And just to make this point, about 90% of health center patients across the country make less than 200% of poverty. And for those of you who may not know exactly, I just put on the bottom right there what the poverty level is for an individual or a family of 4. So you can kind of multiply that by 2, and that's 90% or below that number. And we take care of this, we take care of a lot of racial and ethnic minority groups. So the sum of this slide is that 62% of health center patients are members of racial and ethnic minorities compared to the US population in general, which is about 40%. So we take care of a disproportionate number of the groups that have and are experiencing a lot of the disproportionate effects of climate change. I think everybody kind of knows this, but I think this is the point about why health centers need to get involved in this issue. So here I kind of picked out headlines from either medical articles or news articles in the last few months to just make the point about health equity. Nothing particular here, but here's a EPA just said all the ways climate change will hit U.S. racial minorities, and it's a long list. Air pollution disproportionately harms people of color, pregnancy and climate, communities of color and low-income communities are often more exposed to climate. So this is, I think everybody knows this stuff, but it's out there, it's increasingly out there, and it's very relevant for everybody, and it's particularly relevant for health centers because this is who we take care of. And this is so I'm interested in climate change, and I've been working on it since I retired as CMO, kind of as like my voluntary thing, because I agree with one of the previous speakers who said it's the issue of the times, right? It's the most important issue. But what I want to say is that I think there's a shift going on, and I think this is what needs to happen, and this is why it's really good that you guys are talking about this, which is that I think climate change more and more needs to be talked about as a health issue. And I think not as a, not primarily, I don't mean exclusively as a health issue, but not primarily as a conservation, ecology, biodiversity issue. I just think that as talking about climate change as a health issue is going to have more appeal across the whole population and less likely to meet some resistance that the other way of thinking about it historically has been. And this is a survey showing that if you actually asked a lot of people all over the country, a lot of them agree that they support changes that protect people's health. I don't know that that's a surprise, but I think this is why I think the healthcare systems, schools, health centers, whatever, need to be thinking more about climate change. So I've been thinking about what's the responses from our point of view, from the clinic's point of view, what can we be doing, what should we be doing? So, climate change people typically talk about, they talk about two approaches. One is like adaptation, which is like people use the term resiliency a lot. And they talk about mitigation, like lowering the carbon footprint. So I've been thinking about this. And for those of you who are familiar with the terminology, I think of resiliency and adaptation as kind of like what we call secondary prevention. So, secondary prevention means like if you have heart disease, now you want to do things to prevent yourself from getting a heart attack. And I think that's what resiliency is. Climate change is here, wildfire smoke is happening, heat waves are happening, air pollution is happening. How do you keep people well in the face of that kind of those insults? How do you keep people, and which people are more vulnerable? So who needs to be involved in this? So this is where I think providers need to understand this. They need to educate themselves about what they can do. They need to be prepared for disasters. So that's acute. In California, we have fires, and people have to be prepared for what to do when there is a fire. Health centers have been there when there is a fire. The fire up in Northern California a couple of years ago that burned down part of Santa Rosa actually destroyed one of the health center clinics, which was the residency teaching clinic, that people had to really figure out what to do in those circumstances. So people need to be prepared. we need to be thinking, and I think this is, maybe the point the previous speakers are talking about. What can you tell patients? What can you tell communities? And for health centers, our patients are, again, among the most vulnerable. What do we have to offer them? And truthfully, I've looked a little bit, and I haven't really seen a whole lot that's been sort of organized around the needs of patients, particularly what I would call low literacy patients. And I have something that I'll show at the end just as an example of this. But I think, what can providers, clinicians do in clinic? What can clinics do with their population? What are the media channels that they can use, whether it's EHR portals or texting or things like this? And what information do you want to give people? And this is, I think, an active issue for us talking about in the health center world. You know, who's vulnerable? Some groups are more vulnerable than others. And what are the specific issues we need to be thinking about? Clearly, in California, we got to be thinking about heat waves in some parts of the state, and we clearly have been thinking about smoke. Health centers, there was a call a couple nights ago, which probably had about 50 people from health centers across the state talking about what to do about smoke. Patients need to be understood. First, we need to, and then patients need to understand what an AQI is and how to think about it and how to respond to it. What can they do about it? And because I don't think they know necessarily. And then what about mitigation? So resiliency is really important. We need to be doing more about that in our clinics, but we also need to be thinking about mitigation. And I think one of the concerns in the political world is there's going to be a movement to focus a lot on resiliency and not on mitigation. And I think we need to be really sensitive to that issue. But even for health centers, which we're not big, we're not Kaiser and, big hospital systems. Nonetheless, there's a lot of us. We have a carbon footprint, and we need to be thinking about what we can do with it. We also are really big advocacy in California. We have a big advocacy organization, our state primary care association, that advocates a lot. And we and a group of us are really trying to get them interested in advocating on behalf of climate change issues, because we think that's really relevant to our patients. And then I think med ed is really important. And of course, my med ed interests are moving into the GME world and what's going to happen in the GME world, because those are the people who are going to come out who actually are practicing and who, will be hiring, we hope. Was it Catherine Conlon who told me she helped develop this slide? So I'm going to give her a shout out. So for those of you who haven't seen it, this is a great slide explaining the connection between the physical effects of climate change and health. This is actually a CDC slide, so I take no credit for this slide except that I found it. And in the in circle is what happens with climate change around changes in weather, sea levels, rising temperatures. But then you go in out circles concentrically going out. So here are the effects that now are actually the effects on the world we live in. And air pollution, and I put like smoke in here, and heat waves, extreme heat, effects on water quality, food. There's a big issue around allergens and a longer seasonal allergy season, and vectors. So this is all this is the intermediate effects of climate change. And here's the last one, is where it actually comes into your clinic, into the ED. This is like what's going to happen to patients and communities where they're going to get sick. And here's the whole array of things. So it flows out from the changes in the climate through the changes in our world into the health of our people, ourselves and our patients. So this is a great slide. I think it's a good teaching slide as a basic one for everybody. Advocacy, as I said before, I think is an important issue. And I think, my hope is that the health sector as a whole and health centers as a part of it will become more engaged in taking a role in addressing climate change from an advocacy point of view, because it is really important to us. And we have something to say about it. And again, partly because we have health expertise, and so much of this is affecting the health of our patients and our communities. So what can we do? We can, we're talking about partnering with other organizations in our communities and in our state. building a climate change agenda into our regional and state primary care associations. And that's something I mentioned before, which is really an active issue we're working on in California. We want to take advantage of existing advocacy structures. So we need to talk about what to do in the clinic and what to do in a building. We need to talk about lowering our carbon footprint, but we also need to talk about how to become advocates. And so I talked to you about, like, where's the patient ed material? Now you guys may know some, and if you do, I think it's great if we start sharing it. But I couldn't find much, and I had to give a talk a couple months ago to a group in what's called Region 8. Region 8 is the area of this country where Colorado, Utah, Wyoming, Nebraska, the Dakotas, Montana. So it's got a couple urban areas and a lot of land that is pretty rural. And they were interested in what's about wildfire smoke. And I'm not an expert, but I've educated myself, and I know those people, and they like me, so they thought I should do this. And so I did, and I was looking for something that we could, what's a handout? So this is a handout that we created based on that conference, the people at Region 8 and myself. It's a 2-page handout. It looks like that. It's written at about probably a 7th grade level, which we sometimes think is a little too high for our population in general. We're like 5th, but it's better than the college-educated stuff you see in a lot of places. And, the question is, what do you want people to know? How do you communicate that in a way that they can actually understand, and what can they do with? Can they do something with it? What's relevant? What can they actually do with the information you give them? I'm happy to share this. I'm actually really love to have people actually see if they like it or use it, because we're really looking for some feedback on whether this has any value at all. How much time do I have left?
You have about a minute left, but
Okay.
I saw you were on your last slide.
Yeah, well, I got one more here. I just want to throw this out to people just to show you how this is moving into the clinic. And this is going to be a paradigm shift, I feel. So for those of you who may know, Renee Salas is a pretty well-known ED doc at Mass General who writes a lot about climate change. And this is a commentary she wrote in the New England Journal maybe about 3 weeks ago. And I thought this was fascinating because she talked about a case of a mother who brought a young child into the ED recurrently for asthma attacks, which that happens, right? And this had happened, and the mother was frustrated. She says, I'm doing everything people tell me to do, and my kid doesn't get better, and she keeps getting sick. What's going on here? What can I do? This is a mother in, need of some help. So I assume Renee, whatever, says, for the first time, she actually went to the map and typed in the kid's address to see where they lived. And not surprisingly, she found they lived very near a confluence of multiple highways. And that it was almost certainly that the pollution in the air, exacerbated by climate change as we know, is really the source of this child's really, maybe most of the source, or a significant contributor to this child's recurrent asthma attacks. Okay, I say this because I think this is where the world is going to need to move, where one of the social determinants of health is going to be climate change and the effects of climate change. And clinicians are going to need to be sort of thinking about this in the exam room eventually. They need to have ways of documenting this in the exam room. And then, of course, for all of us, because this is always an issue, is what are we going to do about it? What are people going to do about it? What are health plans going to do about it for the Medicaid population? Can they start thinking about air purifiers and air conditioners for people to keep them well, just like they think about inhalers and other meds and steroids and stuff like this? So I think this case has these implications that I think are going to have some ramifications over time for how we think about the whole relationship between climate change and health. Okay, done. Boom. Thank you.
Oh, thank you so much, Dr. Henley. That was really enlightening. I think since you provided a very good kind of comprehensive approach to how you address advocacy in different spaces, I was wondering if you could talk a little bit about what was your biggest challenge or barrier you faced while you were working with advocacy in various spaces, and how you think?
Yeah, I think it's a great question. So I just think for us, the health center movement, let's say in California, but I suspect this is true nationally, it's just beginning. So we're good at advocating on behalf of issues that are what we might call the bread and butter issues to health centers. What's the Medicaid policies? What's Medicaid reimbursement like? How much meds are costing? What do we do to get licenses? How's recruiting and workforce? I think the big thing is to get the advocacy people to be thinking that climate change belongs in their plate of bills that they should be following because of its significant effects on the health of the populations that we take care of. So I really think there's a lot of competing agendas. There's competing agendas for curriculum, as previous speakers meant. There's competing agendas for health centers and for advocacy. And I think it's trying to get them to sort of broaden out what they are going to advocate on behalf of. When they get into it, I think they'll be good because we're good at advocacy, but in California for sure, but they got to get there.
Thank you so much, Dr. Henley. And so to keep us moving on time here, we're going to move forward to the full panel discussion where everyone can have an opportunity to ask questions to Dr. Henley as well as the rest of our speakers. Amy, would you like to take that off?
Absolutely. Thank you.
Stop that.
Thank you. Again, thank you to Megan, Dr. Iverson, Dr. Whelan, Dr. Henley for your very, very insightful presentations. Just a reminder that all of you can continue to enter your questions into the Q&A, and then we'll go ahead and get started with Megan. There was a question for you that came in while you were presenting from Robert Gold. So for Megan Duckworth, I've been very impressed with the work of Brown University's Watson Institute Costs of War project, which provides comprehensive assessment of war and militarism impacts on human and planetary health, including ecologic footprints of massive pollution and the use of fossil fuels, as well as direct costs of war. Is any of this incorporated into your curriculum?
Robert, that is a wonderful resource that you pointed out. And I can say that no, it is not. I was unaware of it, as I think most of the students who participated in the Planetary Health Report Card were. And I think this speaks to the siloed nature of the medical school. One of the other aspects of the report card is looking at interdisciplinary research. And that's something that we're working on. We're trying to bridge the gap between the medical school and the biomed system and other aspects of the Brown University system that are focusing on climate change and the effects of human actions. War and our role as the US has not been addressed in our education, and I think that's really valuable. So thank you for pointing it out, and it's something that I'll be taking with me from this talk.
Sweet. Thank you so much, Megan. And I just wanted to echo Amy's sentiment and thank everyone for speaking today. It's been really interesting to hear everyone's talk. The next general question that we have, and this might be actually applicable to everyone, is something that deals more with patient education. So patient education is often seen as the last part of an encounter after all the medications and labs are ordered. In y'all's opinion, what is the primary logistical barrier to providing thorough climate education in each patient visit? And whoever wants to start can take this question.
Well, I brought patient it up. I'll start. And good question. Lots of possibilities. First, I think the question is what's relevant to the patient in hand in a particular encounter, and also what's the best way to get the information to them. I think that for patients, multiple channels are better because patients take information in different ways. So some may be from the clinician, some may be from the MA, some may be a poster in the exam room, some may be a handout, some may be through the EA. You know what I mean? There's lots of channels here. But I think what patients really need is, health center patients particularly, they need some basic information so they know what to do in certain circumstances. I think that's really what I think needs to happen now. I think the next issue will be this issue I talked about at the end, which is, can we relate their disease or their condition to climate change in some way? And therefore, we're having another discussion about it, kind of like in the social determinants of health world. First thing, I think they need to know what precautions to take when there's smoke or heat or bad air pollution, stuff like that, and when to even know about it. So that's what I'd say. Thank you.
I want to acknowledge one of the barriers here is kind of similar to what it's like to incorporate a planetary health curriculum into a school of medicine, which is that the curriculum is already extremely packed. Your clinical days are already extremely packed. And there's a logistical barrier to doing this. I think, to Dr. Henley's point, I think the more you can make it relevant to that particular patient is very important. To add on to that, I think we need to think about not just what can we as physicians do in the clinical encounter, but there's a whole interprofessional team that works at our health centers who, we could continue to help in this process as well. And there's so many touch points for patients in our healthcare system where we could be doing this education. So I think there are many different opportunities. And I think the bottom line is that it probably needs to be a multi-pronged approach and should be systematically integrated into whatever health system you work in. So, whether that's you as the clinician in a particular patient encounter, doing some education around that patient's illness, or, handing out flyers and engaging the rest of the clinical staff in your health system to, work with people in the waiting room. So I think there's a lot of opportunity.
Yeah, and I'm just going to add one short comment. I agree with all of that. I think this is also, the patients who most need attention and hands-on attention are the ones who are medically complex, socially complex. And so that makes it even harder. But I think this is also an opportunity to partner with communities and have community health workers, patient navigators, who can play a great role, I think, in educating patients about, what their risks are and what they need to do to protect themselves.
Yeah, I agree. I just want to add this, which is one way to think about it might be the information a patient needs to sort of take care of their condition that they're immediately facing, and some general information about climate change to sort of gradually shift everybody's thinking about what's going on. That's a little broader and more sort of like publicly directed, like, announcements, posters, general information. And those could be happening concurrently, but with different targets.
I think one thing to add, as a not practicing physician yet, I'm really taking notes from all of our docs here, but from a student perspective, I think that one major barrier to talking about the health effects of planetary or climate change with your patients is that it's not part of standard of care yet. And there's this downward flow of, if something is part of standard of care, then you'll start being tested on it. And so as a student, if things are being tested, we're actually learning them. There's this this is just how medical school operates. You learn the things that are going to be on the exams. And so we right now are also pushing a group of students at Med Students for a Sustainable Future. Jonathan Liu at Stanford has had some important meetings with the student reps who have some ability to advocate for incorporating planetary health questions into things like USMLE evaluations. And so I think that as a student learner, one thing that will help knock down a barrier is even just the education aspect of it for the provider, the future provider.
Absolutely. Thank you so much. So I guess a logical follow-up to this is in terms of, communicating with your patients, we see a lot in the media that there is a great deal of mistrust between providers and community members. So how do you anticipate that medical education can be supplemented in order to overcome this barrier? How have you worked with students or residents to do so?
Okay, I'll go. Yeah, so good point, and I think it's complicated. And I think, there's a lot being written about how to engender trust and build on it. So I'd like to think, I don't think this is always true, but I'd like to think that health centers, because of their historical situation in the community, the fact that they're basically community run and sort of like mission driven in that way, may have a little bit of an advantage in dealing with their patients on this level. And I also understand that that's not uniform, but they have a lot of experience with it. So I think this is, I think this is going to be part of patient education too, or medical education, which is how do you talk to people and how do you communicate and what's cultural humility and how do you get your message heard. Clinicians are generally trusted, albeit some relationships work better than others. And I think that, we need to be cognizant of that. But gee, the first thing is we need to develop materials that are like directed to people who we take care of, not directed to people we don't take care of. The literacy level and that kind of stuff. We need to be sensitive in the kind of materials we develop. I really would like all materials that are developed to actually be looked at by the patients we take care of first before they're actually printed and sent out, to have other eyes on it. So
I think
point.
One other thing that I think is helpful and really any kind of communication, but I think when you're talking about climate change and health, or if you're, trying to work with a community that has been marginalized and maybe has some distrust in the healthcare system, is I think really approaching with curiosity and figuring out what's on their agenda. What are they most concerned about? And then if you're trying to frame, education around climate and health or their health risk or what resources are available, framing it in terms of what they are worried about before you sort of dive in with your, prepackaged message. It needs to address their real concerns.
Point.
And as a follow-up, do you think there's any part of either the preclinical or the clinical curriculum where some sort of directed teaching about this could be incorporated?
And I think in line with both of the things that were just mentioned, the place in the curriculum, I think this belongs, is really, all this is about communication. I don't think we're going to kid ourselves that we can right the wrongs that have happened in the past and within our medical system. And so, it's great that we learn about what has happened historically to give us context. But I feel like most medical schools at this point have content on how to communicate well with patients. And while entering medical school, some folks may not think that is the most important. Ultimately, that ends up being a huge reason that patients may or may not engage in the care that you're hoping to provide them. So I think some of those skills that you learn about, like motivational interviewing, trying to meet people where they're at and developing a plan, those kinds of things make a huge difference in not necessarily righting the wrongs of the historical past, but just building trust with the individual patient.
I agree with all of that. And isn't this really new terrain as a topic? People haven't been talking about the issues around climate change to patients as part of why their health is or isn't good. So I think there's a lot to be learned.
Thank you. I think I have a question more specifically to Megan, but Dr. Iverson and Dr. Whelan, I think this also deals with medical curriculum in general. But so the Planetary Health Report Card is a great tool for introducing concepts that may not be well known amongst medical students and instructors. And as this becomes more adopted and used by medical schools and other training programs, both here and internationally, what do you envision as the next step in really elevating climate change, health, and equity into medical curriculum and beyond? Big question.
Great question. I know. I'm like, oh, let me dream big in responding to this. I think that the goal would be to have a true longitudinal thread throughout the I mean, in an ideal world, I think medical school could happen in 3 years. And throughout the 3 years of medical education, and making sure that there is this like ongoing thread with like a baseline of preparing providers to take care of their patients in a changing climate, but with an ultimate goal of sparking curiosity and passion and motivation to be actors in this space. Obviously, that's a lofty goal, and not every medical student who goes through medical school has any interest in this, but I think that if medical schools could gear their curriculum towards creating advocates and creating actors rather than just passive learners, would be my ultimate goal.
I just want to add one thing briefly to that, which is we mentioned that we developed a conceptual framework for the curriculum that we're using. We didn't have time to get into that, but part of designing that is really thinking about, from the very beginning of the conception of a curriculum, how are you targeting the outcomes of what you're hoping to accomplish, not just thinking about what am I going to implement. And I think it goes to exactly what Megan was just talking about, that our goal is not just to give people pieces of knowledge that they can then take to the clinic and say, you know, here's what I know about carbon, but really to use kind of educational strategies within those teaching sessions to motivate students to engage in this content and really become advocates in the long run. And I think developing the curriculum and thinking about what content goes in the curriculum is one piece of that, but how you actually get there and what educational strategies you use to achieve that is a totally different and much more challenging concept. But totally agree with Megan.
And I would just add one last comment, which is I think that bringing a systems lens to all of this is so important, because the reason we're in this mess is a systems issue. The reason we're dealing with structural health disparities is a systems issue, and the solutions are all about systems. And I think that, you know, students, trainees, physicians all need to realize we're all part of these systems, and part of what we need to do, aside from our one-on-one patient care, is also to work at a systems level to create change.
Thank you. And Dr. Henley, I know you also do residency curriculum, so I was wondering how you think climate change could be implemented into residency curriculum and beyond from there as well.
Oh, I'm looking for help from some of the smart people who are in your group. I've actually recruited 2 residencies who are interested in trying to insert some curriculum formally into their family medicine residency. And because I just don't think there was a paper in academic medicine last year with a proposed curricular draft of what it would look like in GME program. And my understanding is, I don't know, maybe people have picked pieces out of that, but my suspicion is not much. And I think people are looking for the same sort of challenges that Nick and Heather talk about. How do you sort of get it in where there's a lot of competing agendas, and what can you sort of put in? But I think our residents really are wanting this. You know, they're like, you know, they're a few years ahead of you guys, or 1 year, or whatever. And so it's the same thing. For them, it's a really important issue. And I think, so I'm putting a call out there. A, you apply to the program, and B, I'm looking for help from these curricular gurus on how to do this. Thank you.
Thank you so much. I'm sad that our discussions have to be cut short. Thank you again for all of our presenters. Everything you said today was very, very insightful, and I think we ended on a very inspiring note and a call to arms for the next generation of doctors. Just wanted to remind everyone that there is a 4 p.m. panel. It's a roundtable with healthcare leaders on climate justice at our individual medical centers. Someone has already posted the link. We'll give everyone a quick bathroom break, and that will begin at 4 p.m. Thank you all for attending.
Thank you.
Thank you again. It was a pleasure. Very nice to meet you all.
Yeah.
Nice to see you all.